Women don't usually look forward to their annual pelvic examinations.
I've noticed.
But ladies, the good news is that they're no longer recommended by the United States Services Preventive Task Force, the American Cancer Society, and the American Journal of Obstetrics and Gynecology every year, unless a woman has female problems, like pelvic pain or irregular bleeding.
So it's not a screening test as aggressively as it has been in the past.
Yeah, so let's talk about what the United States Services Preventative Task Force does recommend.
Well, they're talking about not needing to do the test except about every 3 years for women who are between the age of 21 and 65. And then only 5 years after that if everything's okay.
Well, what about an HPV, though? Isn't that included in that?
Yes, if you had a previous PAP with an HPV that was negative, that's when every 5 years.
And an HPV is a human papilloma virus.
Exactly.
That they're advertising on television all the time for teenagers to get a vaccination. I think it's Gardasil.
Yeah, well, that's debatable. That's another long story.
But anyway, many of them go away on their own if you do get HPV.
That's why at age 30, it's not really necessary to do the test any earlier unless if you're asymptomatic.
But I think it's interesting for people to know that the gynecologists are now examining people for that also when you go in. So if you have that done and it's negative, then you don't have to go again for 5 years.
Right. And if you're over the age of 65 and your tests have been negative, you don't need to do a PAP or an HPV test again. Isn't that nice?
That's a really good news.
Things are improving. Unfortunately, a lot of the time what happens is we do things by proclamation. And doctors are trying hard to do the right thing, Vicki. They're thinking about what can I do to help my patients the most.
And many people just expect that they're going to get one.
Well, it's been a routine, again, by proclamation, and a lot of that's out of fear that if we don't check, there'll be something wrong.
But what always gets me is like when somebody's had a hysterectomy.
Oh, yeah.
And or their ovaries removed.
Yeah.
The doctors many times still do a pelvic examination.
And a pap smear to go with it.
Like, how can you do it? There's nothing there to pap smear.
I know. I've never done that, and I've disagreed with those people that do. And they say, oh, you should do that because we were taught to do that, and it's important. And I understand that kind of fear because there's a lot of pressure from your colleagues if you vary from the proclamations that are accepted as a standard of practice.
So let's talk about what normally is done for a pelvic examination. When you do get one and, when it's the time.
Well, the doctor is going to do a pap smear and an HPV test probably, and then do a bimanual test, which means he puts his fingers both in the vagina and the rectum looking to see if he can find an ovarian cancer or a rectal cancer.
But do pelvic exams really show ovarian cancer?
They really don't, and that's what these organizations are talking about. They're saying that there's no reason to be doing pelvic examinations looking for ovarian cancer, yet doctors are still stuck that way in their minds, and so they continue to do them. They did a study of 521 OBGYN doctors and asked them about whether or not these tests were important to do for screening for ovarian cancer, and most of them said, yes, we do it, and it's not necessarily because we think that we're going to be able to find an ovarian cancer, but it's like women expect it, and if you don't do it, they feel like they haven't had an adequate examination. And of course, there's also the reimbursement part from the insurance companies. If you don't do a pelvic, you may not get reimbursed much for the visit.
But also, I think it's good for people to know that if you get if you have Medicare, Medicare will only cover you getting a pelvic exam every 2 years, even though it's not even recommended to get it at all after 65. Yeah. But your gynecologist may recommend that you have it every year and tell you that it's, a healthy thing to do. So you pay out of your pocket, and that way they're
I know your gynecologist wanted to do it every year, and I said, what's the point of it? And she said, well, I just feel a lot more comfortable doing it. I said, well, the recommendations of these organizations now is that you not do it. And so she said, well, it's your choice. So here we are.
The thing about if you go to a surgeon, he's liable to recommend surgery.
Right.
If you go to a specialist, that's what they know, you know. And I like to tell this little story about when I was a young nurse, I guess in my 30s, and I was getting some visual disturbances that turned out to be vascular spasms for a migraine. But I didn't know what it was, and it kind of scared me, and I told one of the nurses that I was working with, and along walks this gynecologist, and she calls him over, doctor, and tells her about my symptoms. And he says, well, why don't you come to my office and I'll give you a pelvic. And it was like, a pelvic? I'm having visual problems.
Right.
So then along comes another doctor, and he's a GI specialist. And he says, come to my office and I'll do a colonoscopy.
But see, this is what happens when people are trained to do everything. I know when I finished my training from Duke Medical School and did my internship and residency, I was afraid not to do some of the tests every year. We did EKGs and chest x-rays. We did rectal exams. We did pelvic exams. We did a lot of things that were really done because we're in fear that if we didn't do them, we'd be doing something wrong. And I'll tell you, once you step out of the mainstream of what is considered the standard of practice, it's actually malpractice, even if you're right in not doing these tests.
And you better be careful if you ever get anything positive, because then they want you to come even more often.
Well, if there's something positive, probably you should
Yeah.
come a little more often. So are routine pelvic exams necessary? Yeah, but not nearly as much as we thought. So ladies, you don't have to wait till you're 65 to get out of it completely. But when you're younger than that, maybe just every few years is sufficient.